Hi there, John Ferriman from Balance Physical Therapy coming at you with a question. Why orthopedic residency? It was a question that I was asked this morning by a physical therapist that we were interviewing for a position, full-time position in one of our clinics. And I paused for a moment and I looked her straight in the eye and I said, you graduated from physical therapy school a few months ago. You just passed your board exams. Are you really ready right now, today, for a full caseload to manage all of your patients and everything that entails? Documentation, difficult patients from time to time, different payer models, different ways of scheduling and billing based on payer rules, returning phone calls or emails from physicians and physician offices, giving your patients your absolute best, making sure that everybody gets treatment at every single visit, hands-on treatment, gets fantastic clinical education, top shelf home exercise programs. Are you ready for that today? And she just kind of stared back at me like, I said, I already know the answer and it's okay. Very, very few new graduates are. And the reason is, in school, they have so much didactic information to teach you and test you on from anatomy and from biomechanics and from pathoanatomy and medical conditions, medications, imaging, manual therapy techniques, manipulation techniques, red flags, contraindications. I mean, lots and lots and lots of baseline level information. And that is sort of the acquisition phase of becoming a professional physical therapist. But being in clinic is the application phase of being a professional. And that's why we decided years ago in our practices to formulate and to create an orthopedic residency curriculum, because it was our opinion after years and years and years, 24 years to be exact, in practice, that many of our new graduates simply were not equipped to come into a very highly regarded, busy outpatient orthopedic practice and execute at the highest levels of their license. They just weren't. So our orthopedic residency, I'm holding the didactic teaching model of the spine in my hand. It's one of my favorite tools to walk around clinic with. The reason for our orthopedic residency is essentially to collapse time for new clinicians, but also for clinicians who've been practicing for a year, 2 years, 3 years, and still feel like there are gaps in their thought process when evaluating patients, deciding on treatment plans, deciding when to refer out, deciding on what exactly to do to get this patient the best possible outcome in the shortest amount of time. That's what orthopedic residency is all about. It's for research-based, literature-based treatment decisions, thought processes, algorithms is a popular word that's thrown around, so that you can diagnose, treat, educate, execute, and discharge a patient with the highest level of efficiency and effectiveness in the shortest amount of time possible, so that you are practicing at the highest level of your license. We're all still learning. And the second, the instant that any one of us as physical therapists think that we know it all, we need to find another profession, because it's just not ever going to be true. There's no two human bodies on the planet that ever walk into an outpatient physical therapy practice and present exactly the same way. We all know that. So it's incumbent upon each and every one of us to commit ourselves to continuing to learn and to get better and better and better. And what a better way to learn and to become a master of the basics than to teach in an orthopedic residency program, or to be a resident yourself who then can turn around and teach others. That is how you become a master, in our humble opinion. Here at Balance Physical Therapy, if you're interested in practicing at the highest level of your license, we highly encourage you to visit balancept.com or at BalancePTMove and apply for our orthopedic residency program today. Thank you.